Hello, my name is Ashley Blake, and this evening I'm going to talk with you about Crohn's disease and how Crohn's disease affects a patient on a daily basis. I have a PowerPoint here. I know it's kind of hard to see, so I'm going to attach a copy of it to my speech so everybody can kind of look at it. But first of all, what is Crohn's disease? Crohn's disease is inflammation of the GI tract. It often results in ulcers and bleeding in the GI tract. Crohn's disease can also have external manifestations, meaning it affects other parts of the body outside of the GI tract. It can affect the skin, it can affect the joints, resulting in inflammation and swelling in the joints. It also can affect the eyes, causing eye inflammation, which is also known as uveitis, and kidney stones. Also, malabsorption and vitamin deficiencies, and bowel obstructions, fistulas, and abscesses. Some of the signs and symptoms of Crohn's disease is diarrhea, rectal bleeding, urgency to move bowels, abdominal cramps and pains, and sometimes Crohn's disease will present with constipation instead of diarrhea. So it's kind of just how it affects that person and how it's going to manifest in that person to kind of which way it is. And there's also some associated symptoms such as fever, loss of appetite, weight loss, fatigue, and night sweats. There is treatment for Crohn's disease. There are 5 categories of treatment: aminoscholastics, corticosteroid, immunomodulators, antibiotics, and biologic therapies. It often takes a combination of drugs to get Crohn's disease under control, and the drugs themselves have a lot of side effects. The immunomodulators and the biologic therapy weaken a person's immune system, so if the patient does get sick with an infection, it is sometimes hard for the body to fight off the infection because of the medications. And the biologics are often given by IV or shots. So another treatment option is surgery. 70% of Crohn's patients eventually have to have surgery to remove their bowel at some point in their life. So surgery is an option. It's usually a last resort. They try medicine first to kind of get it under control, but when the medications don't work, it does often result in surgery. There is multiple ways to diagnose Crohn's. The first one is blood work. When they do the blood work, they are checking your inflammation markers, they're checking electrolytes, and also for vitamin deficiencies. There are stool samples, colonoscopies, FLEX-6, and EGDs. These are often, they're scopes that they can look inside your GI tract with, and when they do this, they often take biopsies, and biopsies are typically how they diagnose it because it's a 100% confirmed case. So biopsies are a big diagnostic tool that they use. And also they have diagnostic imaging, which is CAT scans, x-rays, and MRIs. Okay, the impact on a patient's life. Crohn's disease, we often think of the physical impact it has on a person's life, which is huge. The physical impact is very hard to deal with a lot of times, but it also affects a person socially and mentally a lot of the time. Socially, really, because people are often afraid to go out in public because they're afraid they may have to use the bathroom. So when a family member or friends ask them to come out to eat or to go to an event, they often say, "Oh no, I don't feel like going," or they usually just don't go. And that is because they're afraid. It's always in the back of their mind, what if I have to go to the bathroom? Is there a bathroom in the restaurant? Is there somewhere I can go? Because you never know when you'll have to go. So it's kind of hard for a Crohn's disease patient. And also the fatigue is hard on them. So they oftentimes isolate themselves. And oftentimes a friend or a family member, when you tell them multiple times, "Oh, I can't make it at that event," or "I can't make it to dinner tonight," They oftentimes stop talking to you or just stop inviting you because they're always like, well, she's going to say no or he's going to say no. So really, it can become very lonely in a person with Crohn's disease because people just don't invite them no more. And also, the side effects of the medication, there's a lot of them. And really, the corticosteroids are bad for side effects. The side effects include high blood pressure, a moon face, a buffalo hump between the shoulder blades, osteoporosis, acne, and a lot of weight gain. So the medication causes a lot of physical changes to the body, to the appearance of a person. So it often affects the patient's self-esteem. And because of the medications, they start with a low self-esteem and they don't want to be seen by people. They feel judged. So it's really hard for somebody with Crohn's disease when they take the medications or when they're in an active flare that they're going to be socially active or to not be mentally down. So it's not the easiest thing. The outlook is there is no cure for Crohn's disease. There is the medications to treat Crohn's disease. It is a lifelong illness. It does not go away. There is periods of flare-up and there's times of remission. A flare-up is when the symptoms are active, and remission is when there's no symptoms at all. Treatment can improve symptoms and can improve the patient's quality of life. But the main thing is really working with your doctor and figuring out what combination of medicine is going to work for you and what is the best treatment option for you, because you want to have the best quality of life you can. And when we talk about the impact on the person's life with the loneliness and social and mentally affecting, oftentimes when the patient gets better, they improve and they'll get back to themselves. So really, if you know somebody with Crohn's disease, just make sure you don't judge them and you kind of learn about the disease and you learn what they go through on a daily basis so you can better be a friend or a better family member, and make sure you understand and don't make them feel worse than what they already do.